What's really intriguing is that the standard sternotomy in the midline that divides the sternum sounds awful to people. But more importantly is there are very few nerves there. The nerves end there from each side, and there isn't hardly any muscle involved. And when we close that sternum, and it sounds ugly, we wire it, it's as if a fracture was reduced, so the pain diminishes dramatically. And with a little more pain medication than most people get, they are basically pain-free on the first post-operative day or within a few hours of the surgery. The reasons are, one is they can breathe deeply and cough. Some say, well, I have a little pain when I cough, but you don't want it to be painful enough that they don't want to cough, and you can give them more. The second reason is you want the patient to have not only comfort, but confidence that things are okay, and nothing disturbs things are okay like having pain. And it frightens people, and it fits into their preconceived notions of surgery. So part B is, if they're pain-free, they have not only confidence they can take deep breathe and cough, but they feel like they're protected, and they have a totally different attitude about it, about the surgery. And then the last thing is, they don't get pneumonia, and they don't get the complications. And we know that if people have a lot of pain, they may have EKG changes. So the difference in the way we manage patients is two things. Our goal is to make them as close to pain-free as we can. What I tell the patients is, I want you to have only mild to moderate discomfort. If it's bothering you, then it's not right. There are also studies that show that if you keep a person pain-free in the beginning, that they're less likely to need narcotics and less likely to demand more narcotics after their pain is gone, the so-called addiction fear. And the reason makes sense is, if you wait until the patient has terrible pain and then he begs for some pain medicine and you finally give it to him, or you give him too little, he will begin to associate the medication with dramatic relief.